Well, I nominated Zach for this award because of the work he was doing with clients that were homeless and the effort that he put in to find the people and to support them, whether that was early in the morning before his working day started or after the working day had finished. Zach is hardworking, he's non-judgmental, he'll advocate for his patients, and he's a very good team player.
So there's two main things that I love about my job. The first thing is the team that I work with. They're one of the best teams I've ever worked with, really supportive. And the second thing is the model of care that we work to, which is called assertive outreach. And I think it's a brilliant model of care, and it gets great results for our patients.
The reason that I nominated James is there was a period of time on the ward where he had a service user with a terminal illness who unfortunately his property was broken into and he lost a number of personal possessions. James took it upon himself to initiate a number of fundraising activities and actually set an initial limit of hoping to raise about £1,000, but easily exceeded that amount, and the service user was enabled to replace all the items which he'd lost in the burglary.
My job gives me an opportunity to work with people with serious and enduring mental illness. They're a group of people who are often marginalised and living on the edges of society. So you feel quite privileged really to get to learn about their lives, meet their families and help them and their families understand mental illness and give them some sort of framework that might have some impact to help improve their lives, of themselves and relatives. To Chris, my nominator, I'd like to say thank you very much. I really appreciate that you value what we all did at that time and that you could see that I'd made some effort to make sure that we didn't let this situation go by unaddressed.
I'd like to say thank you very much, Joe, for all your hard work, for your commitment, for being so conscientious, and your dedication to working in a service that can be quite challenging work at times, but also to express my gratitude for the way in which it's provided a level of consultation which is over and above what you'd normally expect for somebody to be doing at this stage in their career. So consulting both with the wider trust but also with our partner agencies, with police and probation, and I'm sure they'd want to say the same thing themselves as well.
The Dorset Pathways project is a joint project between NOMS and the NHS, and it's essentially about introducing more psychological thinking to probation services by skilling up offender managers, building relationships and introducing a lot of training to try and adapt their way of thinking about the offenders, to move away from focusing on the offence as such, to trying to think of them more as people with backgrounds. I bring to my team a sense of enthusiasm, calmness at times when things are stressful, and I'm quite reliable, I think, as well.